I have a shift change at 2400. The patient's name is Henry George. He's a 30-year-old male who was admitted today at 1700 with a fracture of tibia and fibia, fallen from skiing. He hits his head. He states that he hits his head but denies loss of consciousness. He had bruises on his face. He will be having surgery tomorrow. He has a splint and an ice pack on. His leg is elevated. Circulation is intact. He's a healthy person, non-smoker. He takes ibuprofen over-the-counter PRN. He gets in Vicodin 1 to 2 by mouth every 4 to 6 hours. His last dose was at 1700. At that time, his pain level was 7 out of 10. His vital signs was taken at 1800. The blood pressure was 130 over 70. Pulse was 70. Respiration was 24. Temperature was 98.4. Oxygen was 99%. And he has saline locked on his left hand. So now I'm going to go check on Mr. Henry. Knock, knock.
Come in.
Hello, Mr. Henry.
Hello.
How are you?
Good.
Yeah. Mr. Henry, my name is Sawda. I'm your nurse. And then I'm going to check on you, Mr. Henry. Can you tell me your name and date of birth?
Henry George, November 5th, 1983.
Okay. Mr. Henry, do you have any allergies?
No.
Okay, good. I heard you fell, right, from skiing?
Yes.
Okay, how was your night?
It was good. I got some good sleep.
Okay, that's good. Are you in any pain?
Yes.
Okay. Well, what's your pain level now?
It's about a 4.
About a 4?
Yes.
That's good. I'm glad your pain has gone down because I was told that you had Vicodin about an hour ago, and that time your pain level was 7, so which is good. Can I look at your leg?
Yes.
Okay. Are you in any pain somewhere? Do you hurt somewhere?
Yeah, my leg, it hurts. It's gotten better since before, but it's still...
Okay, can you tell me where it hurts?
About midway up my leg.
Okay. I'm going to change your ice pack. I can see that the ice pack is worn out. So I'm glad that I brought you a new ice pack. So we're going to put some new ice pack on you, okay?
Okay.
All right. So you said it hurts around this side. What aggravates the pain? Do you know?
Pressure.
Pressure?
Yes.
Okay, so try not to put pressure on it, okay? I'm just going to feel the warmth. And, okay, your toes looks good. It looks a little bit swollen. That's from having the splint and, and also the broken leg. So that's why it looks swollen. I'm going to look at your other leg, okay?
Okay.
Okay. I can see some bruises on your leg. Is that from falling too?
Yes.
Okay, that's good. Can you do your toes for me? Do you feel any numbness?
No.
No? Okay, can you resist me? Push? Okay, I'm just gonna come around and feel your pulse. Okay, that's good. Your legs, it's looking a little bit swollen, but, it's okay. Alright. Can I look at your IV side, please? Okay. Do you hurt anywhere?
No.
No. Okay. Does it itch?
No.
No. Okay, that's good. Do you feel pain when I touch it?
No.
Okay, that's good. I'm just gonna put your head up a little bit. I can see that you kind of low. Are you comfortable this way?
Yes.
Okay, that's good. So, can you tell me where you are at this moment?
In the hospital.
Okay, do you know what brought you here?
Skiing accident.
Okay, do you know what happened before you fell?
Yeah, I didn't. I fell, but I got a few bruises, but I was able to didn't lose consciousness.
Okay, and then after that, were you able to remember what happened?
Yes.
Okay, that's good. Can I look at your eyes? Everything. date and the day and the month of the year?
It is February 20th, 2014.
Okay, I see some bruises on your face too. Wow. You might have hit your head.
Yeah, when I fell, I hit my head.
Okay, can you put your head up a little bit so I can look at your head? Okay, were you wearing some kind of protective, like helmets or anything?
No.
You were not? Okay, but you know,
Just a cap.
okay, it looks good. It looks good. Can you resist me? I'm gonna hold your hands and I want you to push on me. And then I want you to grab my hands and squeeze it. Okay, can I see you open your mouth for me? And bring your tongue out. Okay. I'm just gonna feel here. Do you feel pressure or anything?
No.
No. Okay. I'm gonna sit you up a little bit so I can listen to your lungs, okay?
Okay.
Alright. Okay, can you sit up for me? So I can listen to your lungs. I want you to take a deep breath, okay? Go ahead and take another deep breath. Take a deep breath. Another deep breath. Deep breath. Good job. Okay, can I lay back? And I'm gonna listen to your lungs, if you don't mind. Okay. Take a deep breath. Another deep breath. Deep breath. Deep breath. Okay, I'm gonna listen to your heart, okay? And then at the same time, I check your pulse for a minute. Okay, that is good. Can I check your finger? Just gonna check your capillary field. Okay, do you have any medical history, like do any of your family have like diabetes, hypertension, or any medical thing that we need to be concerned of?
No.
No? So you have a healthy family?
Yep.
Okay, who do you live with?
I live with my wife,
Your wife?
my kids.
Okay, are you married?
Yes.
How many kids do you have?
3.
Okay, what kind of job do you do?
I work in construction.
Oh, okay, that's good, so you're kind of active, huh?
Yes.
Oh, that's good. Do you do activities and stuff?
Do what?
Do you do activities, like do you go to the gym?
Yes. Yes.
Okay, alright. When was the last time you how regular do you move your bowels?
Twice a day.
Twice a day? Is it
Yes.
normal to you?
Yes.
Do you have problem moving your bowels?
No.
No? Okay, can I listen to your bowel sounds?
Yep.
Okay. Okay, let me know where it's hurt. I'm gonna press on your bowels, so let me know if it hurts, okay? Does it hurt?
No.
Okay. Does it hurt?
No.
No. Okay. Have you had surgery before?
No, I haven't.
You haven't had any surgery or anything?
No.
Okay. Yeah, have you been hospitalized before?
No.
So this is your first time?
Yes.
Okay. Another thing is, I'm just gonna check your leg quick. Feel your capillary. Feel. Okay. This is fine. So, what I want to talk to you about is, everything, I have to do vitals,
Okay.
okay? So I'm gonna check your blood pressure. oxygen is very good, 95%, and that is very good. And then I need to have this here so I can feel your pulse. Good job, your pulse is still. Just have to write it down. 95. Very good. Blood pressure is 134/65. I'm gonna check your temperature. I'm gonna put this in your ear, okay? Your temperature is 99.4. Okay, so I got your vitals and everything set. What I'm gonna talk to you about is, since you haven't Vicodin, Vicodin can cause constipation. So do you have anything in mind that can help you, like some kind of laxative to help you move your bowels?
Some prune juice.
Prune juice? Do you want another thing?
Yes.
Okay, so I will talk to the doctor to recommend something or to write something, because you need that, because Vicodin can cause constipation. And since you having surgery tomorrow, you know you're having surgery tomorrow, right?
Yes.
Okay, since you're gonna have surgery tomorrow, the anesthesia can cause constipation too. So we need to keep you going. So we need, I will talk to the doctor to get you something that can keep you going. Okay? And then, how's your urine? Do you go to the bathroom?
Yes.
Does it hurt? Does it burn?
No.
Okay, so, we don't need to worry about that, right?
Yes.
Okay, and then you always get your physical checkups, right? Once
Yep.
in a year, or how regular do you get it?
Once a year.
Once a year. Okay. So another thing is, since you're gonna have surgery, I want you to do some exercise with your lungs, and that's gonna help you. Since you are in bed, it's gonna help you open up your lungs and prevent pneumonia. So when you are in bed, I want you to take deep breath,
Okay.
and then slowly exhale. You do that several times, like every 15 minutes, and you
Okay.
can do that before the surgery and then after surgery. So can you try to take a deep breath for me? Slowly. Can you try again? And then another thing I want you to do, try to take deep breath and then exhale through your mouth.
Okay.
Okay, good job. So I want you to do that several times, at least every 15 minutes. And then another thing I want to show you, do you know this?
No.
Okay, this is called the insensitive spirometer.
Okay.
What I want you to do is, I want you to blow, we want to reach in between these two arrows. And there's a bubble in there. When you blow, the bubble is gonna come up, and I want it to come up in between these two arrows.
Okay.
And then the reason why we do this, it also helps with your lungs and breathing after surgery. So after surgery, you're gonna be using this. So I think it's necessary for me to show it to you now, so
Okay.
that, after surgery, like, so I want you to try slow and get it there. Good job. So I want you to do that at least every 15 minutes, or I know you like watching TV, so when commercial comes on, you can take that and then do that breathing.
Okay.
Alright, do you have any concerns or anything for me?
No.
Okay, so I have your call light over there. Call me if you need anything, and then I'm gonna put you a bit down a little bit for
Okay.
safety. And then call us, don't get up by yourself, okay? Call us, you know, so we can help you. And then try to drink as much fluids. We have some water beside your bed, so
Okay.
try to drink as much that would help you with the bowels too.
Okay.
And then I want you to do some range of motions on your leg too. The leg that it's good. So I want you to flex your leg, and then do some reflexes on your leg, and try to kind of move it, your toes and wiggles while in bed. Try to do it as much as possible,
Okay.
and that's gonna help with circulation too.
Okay.
All right. Okay. Thank you so much, and like I said, call me if you need anything. And then you have pain meds. Don't hesitate to call us, because the pain meds, it's gonna help you ease your pain. Okay, so
Okay.
anytime your pain goes up, let us know, so we can you can have the pain every 4 to 6 hours. Okay.
Okay.
All right. Thank you. Yep. Okay, my focus assessment was checking the patient's leg, and then I have assessed the patient personally. The vital signs, blood pressure was 134/65, pulse was 72, respiration was 22, and the temperature was 99.4. I am concerned about his constipation, because Vicodin can cause constipation. The patient's mental status, the patient was alert, oriented to place, person, and he was able to tell me the day and the month of the year. His airways, ABC, his airways was good. I walk on both sides and check on him, and he was alert. And then also looking at his color was good. With his race, and then there was no any upstress for me to be worried about. The skin was warm and dry. What I think the problem is, with him would be constipation. So I'm gonna talk to the doctor to order some laxative for him to help with the constipation, and I'm also gonna monitor his pain to make sure that the pain is at a level or a pain that we can control, not to go high. So I'm gonna be monitoring him very often, and also check on the